Good morning. Can Oh, I can hear you great. And I see a nice picture of your office in the background. Love
Yeah.
it. How are you feeling?
Great. How about you?
Doing good, doing good. So let me go ahead and make you a co-host so that way you
Okay.
can have all the same functions. I am recording as well. You're welcome to record um, to have that for yourself, but we'll send that out after. Hi, Harley. Okay, so Harley, you are our employer, right? Okay, I think you're muted. Let me unmute you.
Okay, thank you.
I'm going to make you a co-host in a moment. And is Lauren with you as well?
No, I am going to be the only one from Home Instead today.
Okay, awesome. Okay, so we will just, okay, I'm going to help my co-host. So what we'll do is just take these first maybe 2 to 3 minutes and kind of just wait to let some, the job seekers hop on. Good morning. Janet, is that how you say it?
Yes, good morning.
Good morning. Good morning, everyone. We're just going to take a few minutes to let everybody hop on. Harley, I'm going to actually put your employer name.
Okay, yeah, that would be great. Thank you.
Yeah. Okay. Now it's early morning. Everyone's taking a minute to hop on. So while we're waiting, just in this few minutes interim while we wait for some more job seekers to hop on, my name is Christy Sanchez. I am one of our Better Together staff members who's going to be helping host this meeting. And then we have Harley, who is the staff member from Home Instead Senior Care. She's going to be taking it away shortly and presenting her organization and the job opportunities today. And then Cindy Fisher is one of our facilitators and volunteers to help facilitate, help the question and answer time towards the end, and just help overall with the job seekers. So I see we have a few more hopping on. I think if we just maybe wait a few more minutes, if that's all right with everybody. Harley, if you wanted to maybe post in the chat either your link where job seekers can apply, or where they can go to your website to learn more about the positions, or even the email you would have to send any resumes or anything.
Okay, yeah, I can definitely go ahead and type that in here.
Yeah, take that time to do so.
I'm going to go ahead and post our website so you guys can go to our career link on there. That is going to show all of our job postings. I am also going to include my contact information, my email. So if you have any questions, you can go ahead and send that over to me as well in the chat here.
Awesome. Good morning, Tristan. Tristan is one of our Better Together staff overseeing today's call, doing some hop arounds, making sure everything's going smoothly.
Okay. Good morning.
Okay, awesome. Thanks for posting that in the chat, Harley, for our job seekers. I think maybe we can just wait a few more minutes, early morning, let people hop on, and then we can jump into it. I'll give just a brief overview of who Better Together is and how the flow of the call is going to go, and then Harley will take it away shortly. So is that all right with you, Harley, if we wait just a few more minutes, let people kind of...
Yeah, that's
Okay.
fine. I know first thing in the morning, everybody needs a couple extra minutes.
Yep, I know. We have a good and busy day ahead of us. We have 21 employers scheduled, which is pretty exciting throughout the day. So we've got a lot of moving pieces, but we're really excited about that. I think since it's maybe 8:05, I'll just do my introduction, my Better Together introduction while we're waiting, and then Harley, I can pass it off to you. So yeah, Better Together, we are an organization who hosts job fairs. Before the pandemic, we were doing these in person. Now we're doing them currently virtually, and we are really excited for today. And so we are partnering with Next Level Church to provide some volunteers. They're our partners for some of our in-person job fairs in the past. They're going to be on all of our calls today, just helping monitor questions, helping monitor job seekers, and doing some job coaching as well for some of the employers who are choosing to do interviews on the call as well. And then we will have, let me just make sure I'm not missing anything for our schedule. But yeah, so that's kind of who we are. Just some tips for some job seekers, just some kind of ground rules. If you don't mind keeping yourselves muted throughout the duration of the call. And then at the end, we will have a question and answer time that, Harley will be answering any questions that you have. And so if you do, in the meantime, you're welcome to post those into the chat function, just so you maybe don't forget it, or we can make a note of it. And then the end, when we have the question and answer time, Harley can address those and go from there. And so let me see. Oh, Career Source, self-assorted, whoop, whoop. Yes, Career Source is also one of our partners, which is very, very exciting. And we have some great partners in the community just helping run this fair. So, alrighty, I think, Harley, if you want to take it over, would you like me to post that schedule in the chat, or just leave it to you to go through?
I think you can just leave it for now. I'm not sure if I am going to take up the full time slot of talking because that is quite a bit of time, but I definitely want to make sure I leave enough time for being able to answer any questions if there are any. So
absolutely. All right. Thank you.
All right. Thank you. Well, good morning, everybody. Thank you for joining us here. I definitely want to thank Better Together, Next Level Church, Career Source as well for giving us this opportunity to join today. It's definitely new. Typically, like mentioned earlier, we love coming out and meeting you guys face to face. Unfortunately, with the situation we are having to deal with at this time, we are not able to, but I'm glad those of you have jumped on this morning and are, looking for some work right now. One thing I do want to start out with is a little bit of background information about Home Instead Senior Care. So Home Instead Senior Care was actually first established in Omaha, Nebraska, back in 1994 by its founders, Paul and Lori Hogan. The reason they actually started Home Instead Senior Care is because they were struggling to find high quality care for Paul's mother at the time. So fast forward to 2020, we now have over 1,000 franchise offices, and we do employ over 65,000 caregivers nationwide. So it definitely has grown since then. A little bit about our franchise office. So we do actually own and operate 3 different offices. We have one here located in Fort Myers, one in Naples, and one in Punta Gorda. So we do service all 3 counties here in the Southwest Florida area, and we are currently hiring for home health aides. We have been in the area since 2001 and have been providing services to our community. That is something I do want to mention as well, being that we are a home health agency, I do want to make it, very clear that we are not a registry. So you guys are actually our employees. You are bonded and insured by us. So in the event, anything were to happen with either you or a client, you're completely covered and protected. Okay. One thing I do want to mention as well, so for the home health aide position, we do have some requirements that would make someone eligible. So all of our caregivers do need to be at least 21 years old, have a valid driver's license, car insurance, and your own reliable transportation. All of our caregivers as well do need to be willing to undergo a level 2 background screen, which is through the Agency for Healthcare Administration, as well as you must be willing to undergo a drug screen as well. Being that we are a drug-free workplace, we do not allow medical THC, okay? All of our caregivers do need to be CPR certified as well. That is something that if you have no prior experience or are not CPR certified, we do offer on-site training through the American Red Cross. And we incorporate that into our 3 days of mandatory training that we put all of our home health aides through. So you will be going through some state required training materials as well as some Home Instead specific training materials. You would definitely want to make sure everybody is confident and comfortable before going in and working one-on-one with our clients. Okay. I do also want to mention the services that we do help assist seniors with as well. So we do go in and help with everyday living activities. So that can consist of, 4 different services. We do go in and help assist with companionship care, which could be anything, they may need assistance with around the house. We might have to help with some light housekeeping, laundry, meal preparation. We might have to remind them when it's time to take their medication, or even provide transportation in the event they have a doctor's appointment. They need to run errands like go to the grocery store or pick up prescriptions. Now, we do also help assist with personal care services as well. So that's going to be anything hands-on with our clients. So we definitely may have to step in and help assist with bathing, grooming, toileting, incontinence care. We may also have to help assist with transferring the clients as well. So maybe from bed into the living room, up and down from the toilet, in and out of the chair, in and out of the vehicle, if we are going to be providing transportation, those types of things, okay? We do also specialize in advanced Alzheimer's and dementia care. So we do have a lot of clients that are suffering from those diseases. And then we do also help assist with hospice care, okay? As far as some of the benefits that we do offer for our caregivers, that is something I do want to mention. We are the only home health agency in the Southwest Florida area that is offering benefits to all of our employees, regardless if you are working full-time or part-time. So we do offer voluntary benefits, which is going to include like a direct primary care, which is kind of, unlimited doctor's office visits. It does include a telemed program as well. So definitely during these times, not wanting to go into the doctor's office, you can hop on your phone, hop on your computer, speak face-to-face with a physician, and they can get you what you need in order to start feeling better. We do offer dental, vision, short-term disability insurance, accident, cancer, and then we do also offer major medical coverage, which is through Florida Blue for our full-time caregivers. To be considered full-time, you do need to average at least around 30 hours per week. Okay. One thing I do also want to mention, due to the coronavirus right now, we have shortened our waiting time to go ahead and enroll in those benefits. Typically, it is a 60-day wait. We have gone ahead and shortened that down to 30 days for all of our new employees as well. Okay. I believe that is what I did want to mention as far as the positions, the benefits. I know that was pretty quick here. It is definitely a lot of information. Does anybody have any questions at this time for me at all?
Friend. I'm currently working and I was looking for a position as like an office manager or a secretarial. Is that something you guys provide? I've been an office manager in an assisted living facility before. And currently, yeah, currently I work at a church, and due to COVID-19, they're actually doing not a layoff, but well, you could say layoff, but it was retention of force, like reduction of force. So therefore, my last day is on July 31st, but I am already looking for a position.
Okay, yeah, that is something I know right now at this time we are not offering for any type of administrative positions.
Mm-hmm.
That is something we are really looking for home health aides at this time. There is definitely room for advancement with our company, though. Typically, if there are going to be administrative positions opening, we typically hire within our current staff. We offer that to anybody first before we kind of go outside of the company.
Okay, I understand. Okay, great, thank you.
You're welcome. Does anybody else have any other questions for me at this time? I know a few people were kind of hopping on a little bit late.
Maybe, Harley, if you wanted to maybe give a brief overview of some of the things you mentioned early on, or just the general quick overview of who you are, your positions again, maybe to catch up the individuals who hopped on.
Yeah, definitely. So my name is Harley, and I'm employed with Home Instead Senior Care. We are currently looking for and hiring home health aides in our Southwest Florida area. We do own and operate 3 different offices, one in Fort Myers, one in Naples, and one in Punta Gorda. So we do service Charlotte, Lee, and Collier counties. Just a brief little overview I did touch on a little bit earlier about the position. So as far as what our home health aides are doing is going in and working one-on-one with our clients in their own homes. And we're basically going in to help assist with everyday living activities. So, any type of assistance they might need around the house, some light housekeeping, transportation. We might have to remind them when it's time to take their medication. We might also have to assist with personal care services as well. So, anything hands-on, we might need to help them in and out of the shower. We may need to assist them with showering as well. It's going to kind of depend on their ability to function and care for themselves. We may need to also help assist with toileting, transfers. We do specialize in advanced Alzheimer's and dementia care. So we do have a lot of clients that are suffering from those diseases. And then we do also help assist with hospice care as well. Okay. I know in the group chat here earlier, I did go ahead and post our website. So if you are interested in applying or reading a little bit more about the positions that we are hiring for, which is home health aides, you can go to our website online and go to our career tab. I did also include my direct email as well. So if you want to reach out to me individually, I would be happy to give you a phone call later on today, or talk with you about the position via email as well, whatever you are preferring. Okay.
Care, like let's say they need just assistance in balancing checkbooks or going shopping and things like that. Does one need to be certified for all this? Or
So you do not. That is something, being that we are a non-medical home health agency. We have our caregiver staff has kind of come from all over. We definitely have experienced CNAs, LPNs that work for us, but it is primarily for the home health aide position. We do also have a lot of our caregivers, including a lot of our administrative staff as well, actually started off caring for a family member or a friend, somebody that needed some assistance. We do also have caregivers that, this is something they've always been interested in, never really kind of got the chance to try it out because a lot of places do require that, you are a licensed HHA or CNA. So we actually provide 3 days of on-site training that is going to go ahead and put you through these state required training materials, as well as some Homestead specific training materials.
Okay, thank you.
You're welcome.
Hi.
Hi, good morning.
Good
I can
morning.
hear you.
This is something that I'm familiar with. I actually assisted with a friend of mine's mom, and I was curious as to the location in Fort Myers. I currently live in Cape Coral. So where's the facilities? I mean, is it just different homes and residences? That's
Yep, so it's primarily one-on-one care, so you would be going to the client's home and assisting them. We do have a few clients that may live in like a facility type setting, but that's very, very few. Maybe only like a handful of our clients do. Most of them are in their own home still. One thing I do want to mention, since you did state that you are currently in Cape Coral, we do not service Cape Coral. So that is something, as far as our Lee County service area, we go out to Lehigh and Gateway. We also service Fort Myers Beach, Sanibel Captiva, obviously Fort Myers, and then we do go down to Estero as well.
Is there like just a specific person that you would assist, or are there several different people? I mean, like, first of all, I'm sorry that I clicked in a little late. I'm just getting familiar with this Zoom and everything. Is it like just a specific client that you would help, or are there several different ones, or how does that work?
Yeah. So as far as our scheduling and availability kind of goes. So like I mentioned earlier, we, offer full-time and part-time positions. That is going to be based off of your availability. So you have to provide us with what days and time frames you're available to work. And then we match you up with clients that need assistance that falls within your time frame of availability. So it definitely is flexible. Our goal is to be able to try to match you up with a senior, either based off of prior experience, maybe some similar interest. We do have all of our new caregivers fill out kind of like a match criteria sheet. That's going to help us kind of place you with clients that, we think you're going to be able to build that relationship with, and have, a consistent schedule. But definitely, you're going to be seeing more than one client until you can really find that good match and hit it off with them.
Okay, this is something that I'm interested in. However, there's other opportunities that I want to seek. So if this is something that I'm still interested in, I can go ahead after I go through this day of this job fair, and I can go ahead and contact you personally via email. Is how that would work?
Yeah,
I don't really want to commit to anything until I see what all is available with everything else I'm interested in.
Yeah, definitely. Completely understandable. Got to explore your options. So, but yeah, that's something if you, are interested in either applying or, you want to talk with me directly one-on-one and get some more information. My personal email is in the chat, as well as our website. So on the website, if you go to our career tab, that does go ahead and list the different positions that we are hiring for.
Thank you.
You're welcome. Did anybody else have any questions for me at this time?
Marissa, Marissa's having a little trouble with her audio. Can you try to speak again? Let's see if we can hear you.
Can you hear me?
Yes, we can hear you.
Hi,
Good morning.
how are you? Well, as you can see, I'm at work. I'm looking
Yeah.
for another job. HHA.
Okay, great.
So can you tell me about your job?
Yep, so I know
I heard
a
a
lot of,
little bit of it.
yeah, a little bit of everybody kind of is popping in here at different times. But that is something, so I see that you are at work. Are you, do you work at like the hospital or a facility?
Facility.
Okay, okay. Yeah, that's something, you know, definitely if you are looking for another position part-time, you know, we do provide 24/7 around the clock care. So
Night
we
shift.
do, yep, we do offer, you know,
When-
mornings, evenings, overnights, but we are primarily hiring for home health aides. That is something, if you are, you know, like a licensed CNA, LPN, RN, anything like that, you know, we have plenty of those people on our staff as well. But it would be for a home health aide position.
Okay, that's fine. Just as long as you got a night shift.
Yep. So like I was mentioning earlier, how our scheduling works is you have to provide us with your availability. So what days, timeframes you're available to work, and then what we would do is match you up with clients that need assistance that falls within your time frame of availability. So it's definitely a very flexible position for anybody that does have another full-time job. Maybe they're going back to school right now. You know, maybe I know a lot of people are at home right now with their children due to everything that is closed. You know, maybe they're looking for nights or overnights, something
Yeah,
like that.
that's like my
Somebody else
issue.
at home.
Yeah,
So it's very,
because the
very flexible.
childcare shut down and stuff.
Mhm.
So I need a night shift.
Night shift, yeah. So we are definitely hiring for that in all three of our offices right now. So if that's something you are interested, like I said, you can email me directly. My
You
email's in the
put
chat.
your email in the chat thing
Yep, my
where
email.
you just writing me. Okay.
And then our website is as well. So if you know you're not wanting to reach out to me, you can just go right ahead and apply on our website as well. All that information is listed in the chat.
Okay.
Okay.
Oh,
See you.
I see a message.
I had a question about like how does one get paid? Is that through the client that you see, or is it through the agency?
So we're not a registry. So you are not doing anything directly, dealing with anything directly through the client. You are our actual employee. So everything would be
Okay.
through Home Instead.
Okay.
For our pay, we do offer direct deposit, and it is biweekly. That is something typically, our pay rates generally run from about like the 1st to the 15th and then the 16th to the end of the month.
Okay, great, thank you.
Okay, you're welcome. You're welcome. Did anybody else have any questions for me at all about the position?
Yeah, do you have any clients in Naples?
We do. So we service Collier County, Charlotte County, and Lee County. For our Collier County, we do service, you're testing me here. We do service Naples, Immokalee, Ave Maria, Marco Island, and Bonita Springs.
Okay, because currently I work in Marco Island. I live in the border of Marco Island and Naples, so yeah, okay.
Okay, great. Yeah, we do service those areas and we do have clients in those areas. So.
Thank you.
Okay. Oh, yes, yes. So for those of you that I know, there's 3 different meetings going on right now, so people are kind of popping in and popping out. So I'm just going to go ahead and start from the top. Thank you for joining us today. My name is Harley. I'm from Home Instead Senior Care. We are currently looking and hiring for home health aides in the Southwest Florida area. We do offer services to Charlotte County, Lee County, and Collier County. So we do have a pretty big service area, so that is great. Little bit about the position as far as what our home health aides do. So they go in and work one-on-one with our clients in their own homes to help assist with everyday living activities. So we may need to help assist with things around the house. You know, generally a typical day might look like you go in, you know, you greet your client, you might have to assist them and get them up out of bed if it's in the morning. You know, help get them cleaned up, whether it be shower or just, you know, brush their teeth, whatever they can do at the bathroom sink there. You might have to make them a meal, so breakfast, lunch, or dinner. Some of our clients might need transportation, so in the event they have a doctor's appointment, we would take them to their doctor's appointment and then take them back home. A lot of our clients and caregivers, you know, they do a lot of activities in the home together to just stay busy, especially during this time when we can't go out and do things. So, you know, a lot of our clients, they might read, do puzzles, any type of engaging activity. Some of our clients and caregivers work out together. It's definitely, you know, nothing strenuous, but little movements are good. It could be something as simple as sitting down and just having a conversation with them. A lot of our clients do live alone, so they do not really get that chance to actually stop and talk with someone. And that is probably definitely one of the most rewarding parts of this position, is being able to go in and provide that care for a senior that is really needing it, especially those that do not have, you know, any family members left or in the area. Okay, I do see there. So we are a non-medical home health agency, so we are only hiring for home health aides. We do not provide skilled nursing, but that is something we do have. Like I mentioned a little bit earlier, we do have CNAs that work for us, LPNs, RNs. That is something, if you are licensed in the state of Florida and you are interested in working with us, it is going to be a little bit higher pay rate because you do have that additional training. However, it would be for a home health aide position.
Chatting properly.
Oh, were you mentioning something, Doreen? I think you kind of cut out there.
Yeah, I have a quick question for you. What is the pay rate if you're not licensed and you're just doing home health care and coming in and helping with basic needs?
Sure. So that's going to vary per county depending on where you're located. I believe you had mentioned you're in the Cape Coral, correct?
I'm in Lee County, yeah.
In Lee County, okay. So our caregivers do start out at $11.50 during the week and $12.50 on the weekends. You will get a higher rate of $13 an hour if you are willing to travel to Fort Myers Beach or Sanibel Captiva area.
Okay, thank you.
Okay, yeah, you're welcome. You're welcome. Okay, and then I do see there's a question here. We are looking to hire candidates as soon as possible. That is something with, you know, this type of company, that is something we are continuously signing up new clients, so we need to be continuously hiring as well. So we are currently looking and doing interviews. That is something I do want to mention as well. Due to the coronavirus, we currently right now are not allowing walk-ins at this time. Generally we do, but we are not. So that is something you would need to apply online. And then we would reach out to you, go through kind of our phone screen, typical first interview. And then we are asking some kind of like knockout questions regarding the coronavirus. That's does not mean you're going to be ineligible for the position. It just means that you would not be able to come in for a face-to-face interview at this time.
And then it looks like Sean asked a question as well. I'm not sure if you saw this, Harley, or answered. I apologize if you already did, but he said, do these clients typically have nurses on site as well, physical therapists, etc.? Did you see that one or answer that one yet? If you did, I'm sorry.
Oh, let me see here. Okay, so some of the clients may have nurses on site or physical therapists that come into their home and provide those services. It's just not through Home Instead. So sometimes when you do go in, there may be other healthcare workers in there assisting the client as well. That is something I do want to mention. Typically for those clients that are on hospice, you know, being that we are non-medical, we're mainly going in there to help assist them and make them as comfortable as we possibly can. But in regards to, you know, medication, we're not administering that. We're not inserting or removing anything from the body. We're not providing like wound care. They would have to have somebody come in to assist with those services. Okay. Let's see. So for our Collier County right now, amount of hours worked, so that's going to be based off of your availability. So you have to tell us, you know, what days and timeframes you're available to work, and then what we do is match you up with clients based off of your availability. So definitely the more open that is, the more likely we're going to be able to match you up with clients. But we do provide 24/7 around the clock care. So we do have morning shifts, evening shifts, overnights available. So that really is going to be based off of your availability. But as of right now, definitely in all 3 of our counties, we are very busy. Like I mentioned earlier, we're still signing up new clients at this time. So we still need to be hiring more help. And then also that can vary from client to client as well. Going over the services that we provide, we definitely do have, you know, definitely very different clients. So we could have one client that mainly is only needing maybe companionship care and some light personal care. So you might go in, you know, help them clean up the house a little bit, help with errands. You know, they might need assistance getting to and from the bathroom, but once they're in there, you know, they're capable of handling that themselves. On the other end of that spectrum, you could have somebody that is in hospice care and they're bedbound. You know, they need to be fed, they need to be cleaned in bed. You might have to do some reading or, you know, play some music, anything that they would like to kind of make them as comfortable as possible. So each client is very, very different, and they're all going to have their individual needs that we're going to be assisting with. Apply online. Okay, yes, thank you, Christy, for posting that. Yeah, so the website there to apply online is going to be homeinstead.com/201. That is going to be for our Lee County office. I know you had mentioned, Sean, that you are in Collier County. If you do apply for one of those positions on there, you can just state that you're looking for Collier County, and then we can get you over to the correct recruiter. And then my direct email is also included in there, so harley.anderson@homeinstead.com. If you want to go ahead and just shoot me a quick email and let me know that, hey, I was on the virtual job fair today, I'm interested in this area, I can also send you a direct application to your email as well. So whatever works best for you. Okay. All right. Okay, does anybody else have any questions for me at all this morning? Oh, Doreen, I think you're muted again. I can't hear you.
Okay. Can you hear me?
Yep, I can hear you now.
Okay, do you typically have females working with females and males working with males when it comes to this assisting?
Yeah, so I mean that's really up to the caregiver, you know, whether you are comfortable helping with, you know, female clients, male clients. Generally, you know, you may be put with both, but if that's something, you know, you don't feel comfortable, you know, that's completely okay as well. That is something for our male caregivers. We do only allow them to work with our male clients.
Okay, thank you.
You're welcome. Okay. Does anybody have any other questions for me at this time? I know people are kind of jumping on and off here and might miss some information.
Harley?
Yes?
Okay, I guess I'm gonna go off video. I just wanted to thank you for your time. You were very helpful, and I probably, if you know, this is something that I am interested in, I'm gonna explore my options and then take it from there. But thank you so much.
Great. Yeah, thank you for joining us today, Doreen. It was nice meeting you.
You too. Now I just gotta stop video, right? Very good.
I believe so. That is a good
Okay.
question. This is new for me too.
Me
So.
too. All right, thank you, sweetie. I'm gonna go.
Before you go, Doreen, my name is Adriana Shepherd. Oh, damn.
Uh-oh, that's all right.
Doreen, if you're still there, my name's Adriana. I'm a reporter with Wink, and I'm doing a story today on the virtual career fair, and I was wondering if you might be available to do an interview with me about your experience today.
Was she speaking with me?
I was.
Oh, I'm sorry. Go ahead. I'm sorry.
It's all right. I'm with Wink, and I'm doing a story on the not career fair, sorry, job fair today, and I was wondering if you might be interested in doing an interview with me about your experience.
When would you like to do it?
Whenever you're available. I'm
Yes.
at the liberty of everybody else here.
Actually, yes, I would have no problem doing that. They've been very helpful.
Awesome. So can you I know this is a little weird, can you throw your email down in the chat and I can send you an email?
Okay, let's see how I do.
You can even click on private chat, Doreen, if you only want your email to go to her.
All right, hold on. I just lost everyone somehow.
Yeah, it's only letting me do everyone, which is why I ended up kind of hijacking this process.
And Doreen, just so you know, we did an interview this morning with her for Better Together, and it was great. So I'm glad that you can participate, and we'll be in the article together.
Somehow I just got to Zoom. I don't know what just happened here.
Maybe, Adriana, do you want to tell her email and she can email you back? That way we can.
Yeah, why do we do it that way? Can you
Sure.
hear me?
So I just threw my email down in there. I can put my number in there too, whatever's easiest.
I lost her face all together now. What the heck?
So my email, if you've got a pen and paper ready, it's a doozy.
All right, hold on.
Name is really long. My parents weren't very helpful.
That's okay. Go ahead.
So it's andriana.shepherd@winknews.com. So that's ANDRYANNA and then dot SHEPPARD wink, W-I-N-K, news, News.com.
All right, let me repeat it. So that was Andrea, ANDRYANNA, dot Shepherd at winknews.com.
Yeah, and Shepherd is SHEPPARD.
ART, yes. Okay,
Yeah, that's it. Thank you.
thank you.
All right, I'm gonna mute myself now so that you guys can do what you're here for.
Thanks for doing that. So Harley, we have about 15-ish minutes for the rest of this call. Would you like to go over any other, reiterate any job positions, or leave it open for any more questions? How did you want to handle it?
I can just go over and reiterate, what we're looking for, kind of going over what we're helping to assist with again. For those of you that have been on since this morning, I do apologize, but I know people are kind of jumping on and off since there are 3 different meetings going on this morning. So, but like I had mentioned, so I am with Home Instead Senior Care. We are currently hiring for home health aides in the Lee County, Charlotte County, and Collier County areas. Basically, we provide services to seniors one-on-one in their homes. So we do go out and help assist with everyday living activities, which is going to include companionship and home helper care, which could be anything from meal preparation to medication reminders. You might have to accompany the clients to their doctor's appointments. You might have to go out and do some grocery shopping for them. We may have to assist with laundry, light housekeeping, definitely socializing as well. A lot of our clients are, alone at home and isolated. So just having an engaging conversation with them as well. We do provide personal care services, so that is going to include anything hands-on with the client. So bathing, dressing, incontinence care, mobility assistance, and then we do specialize in the Alzheimer's and dementia care, which we do specialize in that. So the majority of our clients are suffering from those diseases. So definitely going in and helping, kind of manage those behavioral symptoms that they do get with the disease, definitely encouraging engagement with them, keeping them not only, physically engaged, but cognitively engaged as well. Assist with those activities of daily living while we're in there as well. And, the primary thing is being able to keep them safe in their own home so that they can stay home for as long as possible. And then we do also offer that hospice support as well, which, is going to be making them as comfortable as possible. Could also definitely be respite care for, maybe a family member who is their primary caregiver, or they may have, another family member or agency that they have somebody that comes over and helps full time. So this is just kind of respite to give them a break as well. Okay. And once again, I believe it is still in the chat, but for those of you that had hopped on a little bit later, if you are wanting to go ahead and apply, our website, and I can go ahead and type it in here again as well. To apply online, all you need to do is go to that website and go to our career tab. That is going to go ahead and show all of the job postings we are currently hiring for. Or you can go ahead and email me directly at my email here, and I can go ahead and answer any other questions that you may have, or I can go ahead and send you over a direct link to the application. Good morning, Louise. All right. I know some people are hopping on here again late. Please, if you have any questions, let me know. I want to make sure I get those answered for you before our meeting ends this morning. Hi, Louise. I'm doing well. How about you? On the job. Yes, yes. So we are hiring for home health aides right now. Some details on that position. So basically, you would be going in to work one-on-one with seniors in their own homes. And we're going to go in and help assist with everyday living activities. So we might have to go in and help assist with some companionship care. So maybe some meal preparation. We might have to remind them when it's time to take their medication. Might have to do some light housekeeping, laundry. We may also have to assist with personal care assistance, which is going to be anything hands-on with our clients. I will say the majority of our clients are needing some type of personal care assistance. So whether it be assistance with bathing, grooming, toileting, incontinence care, transferring. It may also include dressing the clients as well. And then we do help assist with Alzheimer's and dementia care and hospice care. Okay, okay. Now that is something I do want to mention. I briefly mentioned it earlier before as well, but we do have some requirements that all of our caregivers do need in order to be eligible for the position. So all of our caregivers do need to be at least 21 years old, have a valid driver's license, car insurance, and your own reliable transportation. All of our caregivers do need to be willing to undergo a level 2 background screen, which is through the Agency for Healthcare Administration, as well as undergo a drug screen, being that we are a drug-free workplace. Our caregivers do need to also be able to lift up to 25 pounds. Okay, so at this time, we do not have any remote positions available. That is something all of our home health aides do go in and work one-on-one with our clients in their own homes. So at this time, we do not, unfortunately. I see a couple more people joined in here. I know our meeting is going to be ending here in a few minutes. If anybody has any questions for me, I definitely want to make sure I'm able to answer those before our meeting does end. Once again, I'm just going to go ahead.
All right, everybody, we're going to have to hop off this meeting because as the Better Together host, I have to start our next meeting. We have 3 employers in each hour time slot. So listed below in the group chat, Lewis, I can list again the email and website if you're interested in applying, and then that way you can do so. And if you have any questions, you can contact Harley at her email listed below. But we are going to have to end this meeting, and if anyone has, oops, I think I added a little bit too much at the end, but Harley's email is there and the website. We're going to have to jump off to start the next call, and we hope to see you on the rest of the calls. Everybody who's still participating, feel free to go back to our website and click on any of those buttons for any of the other employers in their time slot. Harley, thank you so much. and we will see you later.
Thank you so much, Christy.
Of course.
Have a good day.